Cecile, just real quickly, a couple of questions. What is the main bone of contention that
and so there's a sign that's on the door.
Well, the main concern, of course, is that Governor Perry has been putting his political agenda ahead of women's health care access in the state. Planned Parenthood is a provider to thousands of women for their preventive care, birth control, life-saving cancer screenings, and unfortunately, he is poised to cut off thousands of women from access to care. And so the reason why you're seeing hundreds of people here in Austin today, and we've been for the last 10 days across the state of Texas, rallies like this, women saying, we really need access to health care, we need access to Planned Parenthood, and please, Governor Perry, don't cut women off of vital preventive care.
Now, what they say on the other side is that it's state law, and federal law requires states to determine how they want to spend taxpayer dollars. And they made the state law that taxpayer dollars do not go to abortion providers or abortion facilities.
State funds haven't gone to pay for abortions in the state of Texas for many, many years. And what we're talking about here has nothing to do with that. This is basic preventive care. You know, we were just down on the Rio Grande border where women literally have no place to go now for family planning, for basic cancer screening. That's what's at risk here. And I think what's really disturbing to so many women and men around the state is that Governor Perry is literally putting his own political agenda in front of the needs of women for health care access.
What about the Obama administration denying funds? That's supposedly the rumor that they will deny the funds, and so Governor Perry is basically saying he will fund women's health service just without Planned Parenthood, and they'll find the money in the state.
It's so interesting. Governor Perry seems to just be deciding his own self where women should go for care. Literally thousands of women go to Planned Parenthood every single year for preventive care. Those are the patients that are here today that we've been hearing from all across the state. And healthcare providers in the public healthcare systems have been saying we need Planned Parenthood. We are a vital part of the healthcare system for women in this state, and they simply cannot absorb the demand in the state. A quarter of women in the state of Texas have no health insurance. So if I were Governor Perry, I'd be a lot more focused about how to expand access to care than how to throw hundreds of thousands of folks off of basic preventive care in the state.
I was just going to say, in talking to the state folks, they say that yes, Texas does not fund or has never funded abortions, but it does it indirectly because it funds programs that you guys are covering.
Simply not true. And in fact, I mean, Planned Parenthood operates like every hospital in the state. We serve thousands of women with preventive care. And the stories that we're hearing, again, down on the Rio Grande border in San Antonio and West Texas, women are literally coming to our health centers saying, I have nowhere else to go for my birth control, for my basic cancer screening. What am I supposed to do next? And that's the question we're here to ask Governor Perry.
They said if for the law to be changed, there would have to be a special session, which is unlikely to happen. So as it stands
Well,
now,
it's amazing what Governor Perry can do if he wants to, and if he's really committed to the care of women in this state rather than his own political agenda, I have total faith that he would be able to fix this situation. Unfortunately, if he doesn't make a different decision, hundreds of thousands of women in this state are going to lose care purely over politics.